Okay, Dr. Linder here. Welcome back. It's really important when we talk about anatomy and physiology to understand other reference points, right? We've done terms like superior and inferior, medial and lateral, proximal and distal, superficial, deep, contralateral, ipsilateral, cranial and caudal. Now, when we're talking about this specific region here, which is the abdominal region, we can divide it into four quadrants. Okay, there's a left upper quadrant, a left lower quadrant, a right upper quadrant, and a right lower quadrant. And typically, we use this type of terminology. We may say, patient came in fetal position with excruciating pain in the right lower quadrant with a fever of 103 and vomiting. Right? So now we would have to say, all right, let me go back to my anatomy and try and figure out what body parts are located here in the right lower quadrant. And when we look at the quadrants, whether it's the left upper quadrant, left lower, right upper, and right lower quadrant, we can see that right here is the appendix. So maybe in this individual here that had 103 fever, had pain in the right lower quadrant, and they were cramped over and vomiting, maybe they had an acute appendicitis. In the right upper quadrant, we have the liver and you have the gallbladder. So many people that have gallstones, they may have pain in the right upper quadrant, and believe it or not, it refers back here, somewhere back here near the scapula, but on the posterior side. You get this right posterior scapula pain. This bone here is the scapula. It's that shoulder blade. Okay, so I would be familiar with the right upper, know these quadrants and know the main parts that are located in there, right? You're going to have small intestine, right, in just about all the quadrants, but you're going to have liver and gallbladder predominantly in the right upper quadrant, appendix and the cecum in the right lower quadrant. Okay. Now we can also divide them into regions, and there are 9 regions. Now the center portion where the belly button is the umbilical region. The term epi means above, and the term hypo means below. So here's the umbilical region. Then you have an epigastric above the stomach and a hypogastric below the stomach. And sometimes the hypogastric is also called the pubic region because it's near the pubic bones. Here is the inguinal area, and here's the other inguinal area. So there's a left and a right inguinal region. And then near the ribs, chondria is for cartilage, like rib cartilage. So there's a left hypochondriac under the rib cage on the left side, and then a right hypochondriac under the ribs on the right side. So please be familiar with both the regions and the quadrants. I've seen this pop up on a drag and drop like this on some of the lab quizzes. So again, umbilical region is in the center, epigastric above the umbilical, hypogastric or pubic region below. You have a left inguinal and a right inguinal, a right hypogastric and left. Now sometimes this left and right lumbar region, where the lumbar spine is also where your flanks are. So they either refer to this as a left and right lumbar. There are 5 lumbar vertebrae. So it's either called the lumbar region or the left flank and right flank. They're interchangeable terms. So I know them all. And again, the organs don't change, right? The same organs haven't moved. It's just we've gone from quadrants to the 9 regions. Good picture to show what organs fall into which region. Okay. Okay, now we're going to be looking at planes. And there are 3 different planes. There's a sagittal plane, there's a coronal plane, and there is a horizontal plane. And these planes are important when we look at different types of imaging, where we may want to look at a person from a side view or from front to back, or a bird's eye view looking straight down. So we can divide the body into a left and right half, and the left and right half, we call that the sagittal plane. We can divide the body into a front half and a back half, right? If we slice it this way, they call that the frontal plane, also referred to as a coronal plane. So coronal and frontal are the same. It's separating to a front half and a back half, just like we see up on the top left. Then we can cut the body in half right here, and that's called the transverse plane. When we cut the body in half, that gives us a bird's eye view of looking down into the body, where you can see everything from the anterior all the way to the posterior. Everything from one side all the way to the other side, left to right. So here, this has shown up on a quiz before. So what's the highlighted structure? Well, if we go back, frontal plane, sagittal plane, transverse plane, this would be the transverse plane. Then you have a drag and drop. So which one divides the body into an anterior and posterior section? Let's go back here. Which one divides into an anterior posterior? It's the frontal, and the other name for frontal is called coronal. Coronal divides into an anterior and posterior. The transverse divides into a superior and inferior. Remember, the transverse is this one, separating to an upper and lower half. Okay, now we have mid-sagittal. So if we go here, this line, let me do it here, right down the center, that's mid-sagittal because we have an equal right, an equal right and left half. This one is separating into a right and left half, but not equally. So parasagittal will divide the body into an unequal left and right sections. So we see the word sagittal in both of them. We know it's going to separate right and left. The mid is equal. Para doesn't have to be. Okay. Okay. Which section is this? This is the right lower quadrant, but look at the question. Look on the top. What is the medial border of the highlighted region called? So now it's two for the price of one here. They're asking two questions in one. We know that this is the right lower quadrant, but they're asking medial border. That's the key. So here is lateral. This is medial. Now they're asking, what is this called? That's either going to be the mid-sagittal or sagittal plane. Okay, not parasagittal, just mid-sagittal or sagittal plane. Let's look at this one. Well, this is going to be the left hypochondriac region, but what are they asking? What is the name of the line that makes the medial border of the highlighted region? Again, here's the lateral, here is the medial. Now, you didn't learn this yet, but if we mark this all the way up, it's going right through this bone called the clavicular. So this line is called the mid-clavicular line, as is this line, the mid-clavicular line. So that would be the answer, mid-clavicular line. This is the umbilical region. This is the epigastric. This is the pubic. This is the left flank. This is the right flank, also known as the left and right lumbar. This is the left hypochondriac. This is the right hypochondriac, left inguinal, and right inguinal. Okay, let's take a break here.